welcome back. This is Dr. Oolo. We have the case of a lady with the Quervain's syndrome, which is inflammation of the extensor pollicis brevis tendon in the snuff box, the anatomical snuff box. You'll see a picture of that right now on your screen. With Quervain's, it's the patient has a lot of pain in this area here, doing little simple activities like this or moving their thumb. Typically with this, what we call Finkelstein's test, which we'll check right now, has been shown to be positive. The hand surgeon wrote a big letter about that, and they had done 2 injections of lidocaine and cortisone, both of which helped, of course, because it took away the inflammation, but it wasn't correcting the cause, so the problem came back again. So she's in for her 3rd round of treatment, and of course 2 injections of cortisone, more than 2 in the lifetime of a patient in one area, is detrimental to the health of the tendon and causing it to potentially rupture. So the doctors, fortunately, those doctors were smart enough to be able to say that, they shouldn't do any more injections, which was absolutely correct. So now we're going to see if we can fix it a different way. Let's take a look at it right now. The extensor pollicis brevis tendon, the anatomical snuff box, is in here, between those tendons and between the opponens pollicis. So we're going to just do the typical Finkelstein. She's going to hold on to her thumb. We know what it is anyway, but let's just do the test anyhow. So what she's going to do is she's going to bend her thumb this way, and that starts to cause pain. Point to exactly where the pain is. Yeah, there it is right there. Okay. So let's just see if we can pull a rabbit out of the hat with her. Now let's take a look at opponens pollicis as well. Hold your thumb this way. Hold it there, hard as you can. That doesn't hurt as too much, right?
Not that much.
No. This one. Hold it hard. No?
No. It hurts a little bit, yeah.
A little bit there.
Yeah.
But the main one is this way. And then bending the wrist, right? That starts to put the stress on it. Okay. All right. Hold the thumb in, just by yourself. Hold it in. Okay, good. And let's, what I'm going to do is we're going to follow this extensor pollicis brevis tendon up, and we're going to just do a little bit, we'll do the Trigenics treatment down the entire tendon to see if we can change the signal pattern of it. The only thing that concerns me is the fact that she must be doing something to re-aggravate it, and that there could also be a double crushed nerve root entrapment up here at the top of her neck. So I'm going to check the neck first. We look, as I'm checking the neck, I'm palpating here, and she starts to flinch quite a bit. The whole shoulder comes up, and this side she doesn't really have that pain at all. The head's not moving, but this side she just does not like that very much. So from my perspective, she's probably got some compression in the thoracic outlet up here going all the way down, and this can show up as a shoulder problem, elbow, wrist, carpal tunnel, depending upon where the compression is. So we probably have to look at dealing with this site here as well as the actual wrist, or we probably won't get to the root cause of the problem. So we've got C6-7. That's C6-7 on the right here, and we've got the right middle scalene that's heavily contracted. What we're going to be doing now, just went to the wrong side for a second. What we're going to be doing now is we're going to be doing a Trigenic strengthening procedure on the right extensor pollicis brevis, which I'm going to mark in here. I'm going to just mark down which one it is on the right side. We're going to go all the way up the arm. This is going to be a little farther. And we're going to do a lengthening procedure on the middle scalene, and then we're going to do a manipulation of the lower cervicals to try and open up the nerve roots going into the thumb tendons. What are you doing with your hands all the time? Are you typing all the time? Hitting something with the mouse all the time on that right hand?
Mouse, yeah, I'm typing.
And we're using the thumb?
No.
You're using that finger?
Yeah, but...
But you're holding the mouse with the thumb all the time? Maybe.
A little bit. I have small mouse. I don't have it. It is not so big.
Did you ever change the size of your mouse?
Oh, no, I use it for years. Like,
Use it for years, but nobody suggested changing the size of it. You have a small one.
A
A
small
small
one.
one would not be good for this condition, because with the small mouse you have to go hold it like this. You have to support it under like this. This is not good for this tendon. A big mouse is where it's spread out is much better for you, where you can rest your hand on it and you don't have to do that. You have to change your mouse size.
okay.
Make a nice big mouse that you can rest. It's going to be a big difference. This is usually from repetitive stress and from repetitive contraction, so you have to change the mouse size. That's the first thing to do. Okay, so let's do this
Can
now.
I do sports?
Come on over here.
Playing tennis or something like that?
Probably, if it's a move like this, you can't do it until this feels, it seems to be healed. But you have also a problem here, so you need to get some X-rays of your neck, because you have some problem in your neck where there's compression of the nerves that go into this tendon, this muscle. These tendons are all controlled by these nerves here. They don't do anything unless these are working. When these nerves are getting compressed and blocked, then it doesn't allow those tendons, those muscles to be as strong as they should be. So they're weaker than they should be. So with repetitive stress or whatever, because they're weaker, because they're not getting the nerve supply, then they start to get swollen because they can't take the stress. So it's all connected. It's not a coincidence that this is all so tender, this side isn't, and you have this problem here. This is very common. So make a nice smooth movement with the thumb like this, okay? Breathing. And go. This will help naturally take the inflammation out of the tendon. And breathing in. And breathing out. And then we're going to manipulate the carpal bones under there to try and loosen up that retinaculum a little bit more. Breathing. And go. More. Good. I'm going to go all the way up into the actual insertion of it. Good. Breathe. And go. Okay, relax. That was my thumb. Breathing. And go. Let's go the other way up. Bend your wrist the other way.
Oh.
That one hurts there. Okay, relax. That's good. Yeah. Do it again. And relax it. Does it hurt this way as well?
Not now. I don't know. It's just confusing.
And it hurts in here as well?
Yeah.
Yes?
Oh, yeah.
So that's not just a classic D. Quervain's. This is also opponens, which would be this movement she's using with her mouse. So that's not just a total D. Quervain's yet. So there it is there. So that's actually opponens. Polysis is well involved in this. So go ahead. Just relax your head totally. Let me relax. Let it go. Let it relax. No. Push to the right, hard as you can. Okay. And relax. Breathing. And go. Good. Yeah, it's going to be a little sore here. Breathing. It's going to hurt a bit. Go. And relax. Let it go. Good. Beautiful. I wonder if I made it too long. I might have made it a bit long. So we're not sure what the outcome of this case is going to be, although we've certainly helped a lot of D. Quervain syndrome patients in the past. She's had a repetitive history of it now, and a number of injections, invasive injections, that might have changed the consistency of the tendons a little bit, but I think the outcome will still be positive, and if I can get back to you on that, I will. This is Dr. O from Tallinn, Estonia with D. Quervain syndrome on the Dr. O Show. Thanks a lot for watching our Trigenics video today. Make sure that you subscribe to the Trigenics YouTube channel so that you're always sent information on the latest Trigenics techniques and methods, as well as the latest Trigenics success stories. This is Dr. O and the Dr. O Show.